So anyway, I want to point that out. Then after they got the data and they started looking at the subsets of people, they noticed that the diabetics diverged the most. And I mean really diverged. And notice that they diverged right down there from day one. And anybody who does chelation notices that in diabetics, they get the biggest bang for their buck, and it happens immediately. Well, okay, so the bottom line on this study, I could go on, but the bottom line is, and this is one of the things I put in my rooms, is if you look at EDTA reduced cardiovascular events, it was 18%. If you looked at EDTA with the high dose vitamins, it was 26% reduction in events. And that is on top of all these people had to be on optimal medical therapy. So they had to be on their five drug post heart attack, regimen. And look at the NNTs, number needed to treat. I'll show you where that's really important in a minute. But if you look at the diabetics and you get down there to number 6, which is the EDTA plus high dose vitamins, reduced MIs by 51% over the 5-year period compared to people that were treated with placebo. And the number needed to treat was only 6. So you take 6 diabetics who are post-MI and you treat them, and you have a 51% reduction in heart attacks and 43% reduction in CV mortality, 41% CV total events. But these NNTs are insane. You just don't get those kind of, and here's the slide I laminate and I have in all my exam rooms. It's the 5, post optimal medical therapy of aspirin, beta blocker, statin, ACE, and then the chelation. And if you look at that with the 26% reduction at a trial level A, and you compare it to all the others, look at the NNTs on these other things, the ACEs, the statins, they're 33 to 65, 28, 42. I mean, they're huge. And here we have something that if you get the real deal and you're a diabetic and you take the high dose vitamins, you have an NNT of 6. Unbelievable. And so you would think